everyone. Thank you for tuning in to this town hall meeting online that focuses on the COVID virus and how it is particularly impacting the African American community in Boston. We are experiencing tragedy, and there's an opportunity for us here now to talk about the tragedy, but also to move beyond around how we talk about where do we go from here beyond the tragedy. African Americans in Boston sort of represent about 28% of the resident population, but we are 40% of those who have contracted this virus. The white community is about 28%, the Asian community is about 5%, the Latino is about 14%. There is a disproportionality in terms of the tragedy, and we're coming together tonight to sort of talk about that. And we have wonderful, learned, experienced people in our community who bring to this forum insight and ideas and passion and focus about where do we go from here. So I want to thank all of our guests. I'm going to hand this over to Carol Copeland-Thomas, who's going to be our moderator tonight. I want to thank each of them. Beyond Carol, I want to thank each of our guests for being present. And I want to thank each of you who are watching this live on Facebook and even through recording, if you watch it later on than this moment. Carol, thank you again for being the impresario of this event. I'm hoping that it will be fruitful and that we will learn and live beyond the discussions that we had tonight. Thank you, Carol.
Thank you so much, Kevin. I am very glad to be with each and every one of you, no matter where you happen to live. We have a power-packed, distinguished panel, 12 different speakers, all experts in their own field, talking about COVID-19, not just from the perspective of a worldwide pandemic, but how it is impacting the Black community and communities of color. I will introduce everyone at the right segment. We have 3 different segments tonight that we're going to present. First, the medical component of this pandemic and how it has impacted the Black community specifically. We have 3 of the most distinguished physicians in the country who will talk with you with a recorded message or live about the origins of COVID-19 and how it swung to ultimately hit the Black community. Then we're going to bring on our on-the-ground organizational experts. We have a former city councilman from the city of Boston. We have other leaders who are going to share their thoughts on how, from a community perspective, from a leadership perspective, how we need to be prepared, how we need the resources to move ahead. Our third segment will deal with the future and the vision that we have for, in this case, Boston and beyond. We'll talk with leading academicians and experts to help us navigate the way forward so that we are at the table and not on the table. And that's going to be our theme tonight. How can we sit at the table where policy is made so that we become the policy makers along with the others, elected officials, et cetera, and move our community into a resiliency that they've never seen before. This is our new normal in terms of this pandemic, but it does not have to cripple and defeat us. We can become resilient and victors as a result of us collaborating and working together. And that's what we're all about tonight with our town hall. The first segment that we want to bring up deals with the medical community, the present medical condition in the Black community. I would like to bring up the interim chair of anesthesiology for the Virginia Commonwealth University. She is board certified and well respected around the United States. And prior to moving about 5 years ago or so to Virginia with her husband, Richmond, Virginia. She lived in the greater Boston area. She practiced at South Shore Hospital, and she was and is the past president of the Mass Medical Society, the very first African American to serve in that spot. We'd like to introduce you, or to present to you at this time, a brief message. It's about 10 minutes long. We want you to hang in there because Alice Coombs, Dr. Alice Coombs, will share with us the origins of this disease and then how it ultimately impacted the Black community. Without further ado, we'll bring up Dr. Alice Coombs. And we'll now ask our speakers to put themselves on mute and take yourself off camera. Thank you very much. Dr. Alice Coombs, welcome. Thank you so much for joining us.
Thank you. It's a pleasure to be here, Carol.
You know, I wanted to interview you live, but because of your responsibilities, you will be actually working with COVID patients as of Monday of this week. So we didn't want to chance it. We know that you have that important work to do. So thank you so much for joining us. I know it's quite an incredibly busy time for you. Dr. Alice Coombs, give us a sense of where we stand now with this dreaded disease, COVID-19, from your perspective.
So I think over the past 3 weeks, this disease has evolved to be a disease that has disproportionately affected the vulnerable, especially minority, including African Americans, Latinos, and persons who have to live in close proximity to others. And I think we see the data now. The statistics are not hidden. Everything is being unveiled daily. And I think this is reflective of healthcare disparities that historically has been existing in this country. But now it is much more dramatic because we see the impact of a rapidly progressing disease that is actually killing Blacks at a disproportionate rate.
Hmm.
I don't imagine that this would be to this extent.
So this is even a surprise to you, even though you've been in this field doing this work for many, many years. Has the disease sort of picked up pace? How now? Why now are we experiencing so many people of color, Black and brown, who are disproportionately impacted by this disease?
So it's a complex issue. And so part of it is the lack of information to start. And I think that being said, we were predisposed to have worse outcomes with this disease, particularly because of the increased risk associated with comorbid conditions. But even that aside, I think we have to understand the social constructs that exist in our society, as particularly the determinants of health, which come straight across the equality of everything from income to access to healthcare. And so when we look at these issues that are affected, specifically African American and Latino populations, one thing is clear, and that is that early on, the lack of information dissemination is part of the issue. Going from that, we have to understand the way this virus is spread has to do with the close proximity, droplet infection, contamination, surfaces, aerosolized secretions. So that piece of it by itself made vulnerable populations much more susceptible. Living in a house with very, very small distances between the next person within that house is more likely going to increase the rate of transmission. Living in close proximity, living in perhaps some conditions that are not necessarily sanitary. But I think the big picture for this is not knowing the disease pathogenesis, not understanding how the disease was so underestimated in the very beginning. So that's a part of it. But then to take it another level is that even if you were able to understand the disease process, that minority populations were more susceptible because of their other comorbid conditions, diabetes, hypertension, if you have smoking related illnesses. So there were the perfect storm. That was indeed the perfect storm for a host that could be susceptible to a very bad disease. And so it is clear that everybody who gets the disease does not have severe lung disease requiring a ventilator.
Right.
But it is true that when you see African Americans and Latinos and persons who have comorbid conditions, they're more likely to have full-blown respiratory failure and what we call the ARD syndrome, adult respiratory distress syndrome.
Mm-hmm.
And that requires major intervention in terms of putting those patients on a ventilator.
Right.
And so I think that's a piece of it. And then just the whole notion of environmental disparities. I like to bring in some other issues that we don't think about when we think about healthcare disparities.
Yes.
For instance, transportation.
Hmm.
If I'm in New York and I'm on a subway, I'm on a bus and it's incredibly crowded, and I'm next to someone who coughs, we understand now that when you cough, that whole aerosolized cough goes 2 feet in front of the person.
Hmm.
And there are actually scientific studies that show how much the spray of that cough goes in front of an individual.
Right.
The sneeze.
Mm-hmm.
And so the distance that droplet travels is the next contact for the next host of the virus.
Mm-hmm.
And so the virus is the enemy.
Right.
But the way the enemy gets us is that we don't understand how the enemy is coming at us.
Mm-hmm.
And so transportation by itself is another increased risk factor.
Mm-hmm.
If you're driving in a car by yourself to work, you're less likely to be contaminated by another person who's infected. But the other issue is just the educational piece about when and when not to wear a mask, how that started.
Mm-hmm.
We had everyone from the president, even the Surgeon General initially said, don't wear a mask.
Correct.
Save people in the healthcare system.
Mm-hmm.
Now we've done 360 and we've done what Wuhan, everybody assume you have the disease and protect the other person.
Right.
And I think that if we had started that initially, we would be in a different place today, but we didn't have the information necessary.
Mm-hmm.
But one thing is true, and that is Wuhan took a very aggressive, stringent measures. And guess what? They're shopping on the street today, whereas we are not.
Right.
And it is, I think that's a piece of getting, the culturation of you have an epidemic, you have a pandemic that's happened. How do you get the people to fall in line and do the right thing to change the trajectory for what that pandemic looks like? And then, there are also structural differences within an institution, within a community. Mm-hmm. Shopping at a store that's very crowded, the market on the corner, and you're in close proximity with individuals. And recently, we've all heard the data about Walmart employees who have gotten COVID-19 and passed away.
Right.
And knowing that they're at the register and they're ringing up people's groceries, not knowing.
Other grocery stores also. We've had cases here with chains in this region as in other areas, and the grocery attendants have passed away. Yes.
So, I mean, this is, as they say, this is asymmetric information in the worst magnitude. Because if we had known just the information that maybe some of the people who looked at the Wuhan example, they saw that in Wuhan, they said, well, let's do a stopgap. Let's do whatever's necessary to stop the spread of this horrid disease. And I think that's a piece of it. I think we're getting to a better place now that we're doing social distancing, but there's still some sanctuary sites where they choose not to adhere to policies of social distancing. So I want to say something, because there was an anatomy of this whole process. If you remember early on, when they started saying, oh, the coronavirus is impacting this group of people on a cruise ship, and they would show you the pictures of the sick people on the cruise ship who couldn't get off, and then they showed the nursing home in Seattle. They were mostly Caucasian people that were displayed as this person got coronavirus and they look this way. Right. So the initial word pictures that people in this country had were white elderly people, maybe someone who was on a cruise who was stuck with other people who might have been infected because they went to China. Okay. And so when we saw that on TV. You know, there's this identification or disidentification of that doesn't look like me.
Mm-hmm.
Those poor people in the nursing homes, those poor people on the cruise. I bet you they won't take another cruise again. I mean, that's the ideology of what was being read from the TV
Right.
early on in the media. So we didn't get a firsthand picture of, oh, you know what, that can impact everyone, including a 25-year-old, a 23-year-old. And it was only later, and there's been a chain of information that has flowed from the medical personnel, from doctors and specialists and researchers, that, you know, we actually exchange information about how patients present at the different places within the United States. And that's been really helpful. We'll exchange information. I had this patient. This is something you might consider trying.
Right.
And because of the desperation, physicians are trying so many different things. And I think that's good.
Mm-hmm.
Some of the things are working. Some of the things are still in question.
Mm-hmm.
But I think we're getting to a better place of understanding this disease process.
And that is Dr. Alice Coombs, a very profound, prolific woman. She has set the stage for us to begin to understand what is going on with this COVID-19 virus that has just crippled the entire world. I want to bring on our second and third medical experts so that they can tell us more about this pandemic and how it's impacting our society and our community as well. First is Dr. Gloria White Hammond. Dr. Gloria White Hammond is a retired pediatrician, but she definitely has not retired from life. She is the co-pastor of Bethel African Methodist Episcopal Church here in Boston. She is my pastor, and she is also involved in teaching at Harvard University and has a stellar record with her international work in South Sudan, before it became South Sudan, dating back to the year 2000, 2001, when she would make many, many trips over there. She is the founder of My Sister's Keeper, and her work is prolific here in the United States and also abroad. We'd also like to bring on Dr. Jacques Carter. He is a prolific attending physician at Beth Israel Deaconess Medical Center here in Boston. From 2005 to 2014, he served as the medical director of the Prostate Center Screening and Education Program at the Dana-Farber Cancer Institute in Boston. Both have many degrees representing some of the finest universities in this country. Full disclosure, Dr. Carter is also my physician, so I know them, I know their work, I know their reputation, and they are now going to speak to us about our own community and what that means in terms of the work that we need to do. So I guess the first question, I'll start off with Dr. Hammond, just asking you, what are the fundamental issues facing the Black community now that this pandemic has elevated in an unprecedented level, particularly with the Black community? Dr. Hammond? Oh, and we need, Dr. Hammond, Jeff will need to, Jeff, will you please take Dr. Hammond off mute? Let me unmute you. There you are, Dr. Hammond.
Hi, how are you? First of all, thank you so much for the opportunity to be with this esteemed panel and to really talk about what for me and my—
We're just going to have you to speak a little louder and a little closer. Great.
As both a physician and a minister, I've never seen anything like this. And let me just begin also by saying my heart goes out to so many of you who, some of you have been sick with COVID-19. Some people have friends and family members who've recovered or are recovering. And sadly, some of us have friends who've actually died. So this is, in fact, we are all vulnerable. And that's why this topic means so very much to so many of us. Yes, it's been astounding to see the extent to which this has impacted our communities. And as we said, as Dr. Alice said, given all of the underlying conditions and the complications in terms of what she talked about as comorbidities, or sometimes we say pre-existing illnesses, the conditions in which many people live. And again, we understand that this disease is passed person to person. So under these conditions, it really should not have been a surprise that in most of the major cities, there's such an unfair distribution with regard to patients of color. I think it's important, we cannot say enough the importance of doing some of the basics in terms of social distancing. I live in 02121, and I regret that you can still see people kind of operating as though it's business as usual. So we really do need to underscore the importance of social distancing. I want to make sure that people understand those who have those pre-existing conditions that particularly dispose someone to getting this illness. If you're over 65, you need to be sheltering in place. If you need to get groceries or prescriptions, surely there's some young person to help you with that. If you are an individual who has chronic lung disease or moderate or severe asthma, you are at risk. You need to be staying in as much as possible. Individuals who have serious heart conditions, people with severe obesity, and we quibble about the BMI, but if your BMI, just for the sake of getting through this disease, if your BMI is over 40, you need to be sheltering in place. Diabetes, kidney disease, liver disease, all of these are pre-existing conditions that we see in our communities. And these are the people who certainly do need to be staying in place. And as Dr. Alice said, our abilities as social distance is compromised by the extent to which some live in tight quarters, multiple people living in apartments where they don't have the flexibility to isolate. Some of us have jobs that we can't, nobody's going to pay us to stay at home. And that, again, is really important. What's interesting is you look at the data, the people who, one of the highest incidents of COVID-19 is in people who are working in service industries. Chelsea, East Boston has an unusually high rate. Many of those people are the ones who work in food industries and grocery stores. So again, cannot overestimate anything, the extent to which we really do need to be sheltering in place.
So again, you're just reiterating what Dr. Coombs has said in a large way. I'm going to bring on Dr. Carter next. What astounds me as you're talking about people in your neighborhood, probably my neighborhood, all neighborhoods, who are still out thinking that this is just a walk in the park. I have to bring up the Black minister in Richmond, Virginia, who continued to hold service, and he thought the blood of Jesus was going to protect him and his congregation. He ended up giving COVID-19 to his entire family almost, and he died. Yeah. And his sister, his daughter, was just on CNN last night pleading with people to stay home. So this disease is real, and it will kill you. Absolutely. In many ways. Yes. Dr. Carter.
Yes.
Talk to us about, you see patients constantly. You've seen patients for many years. What is your perspective on this disease, given our conversation? And we'll have you just to move up a little bit so we'll get your full volume.
You see me and can you hear me? I hope so.
Hear you just a little bit. The volume needs to go up just a little bit.
Right. Thank you. So I
even more so. Even if you get closer to your computer or sound piece, that'll be perfect.
How's this?
That's much better.
Thank you very much. Listening to Dr. Coombs and of course to Dr. White-Hammond, I mean, I think that this is a special time for us as Black folks in this country, certainly in the Boston area. So we're dealing with all the issues related to the social determinants of health that play a major role here. And one thing about this sneaky disease is that it's sort of come in and pulled back the covers to show really how we have these problems in our communities that need to be addressed. Now, Dr. White-Hammond mentioned the pre-existing conditions, the renal failure. We have more renal failure than white folks. Renal disease, renal failure is a major determinant for this particular disease. If you have problems with your kidneys, you're going to have a problem if you get exposed to this particular disease. She mentioned the occupations. We have all these service workers who are very up close with people all the time, food service, waiters, medical assistants in institutions, in nursing homes where these people are dying. They're at high risk because if you go to any of these nursing homes around Boston, all of the assistants are people of color, almost all.
Mm-hmm.
And they're at high risk. And a lot of these places are now even losing employees because the people are afraid to go to work because of what's going on in the nursing homes.
Wow.
Adequate, and then we have this cultural thing that we're not going to be hurt by this. It's sort of a health consciousness kind of a piece where you think you can get this, but it's not going to bother you.
Right.
Get this but me. And we want to make people more aware that we, in fact, are at super increased risk of dying from this particular condition if we get it. So we have to be more careful and more health conscious about it. We have to cut back on some of the cultural things that we do, high-fiving and hugging and things that we've sort of part of the culture when we meet.
Right.
That has to be cut back during these tough times. And so all of these things will have some major impact on our ability to survive this and decrease our numbers.
Both of you are leading experts. You are physicians. You've seen patients. You have just articulated that, yes, we have all of these underlying factors, renal failure, close quarters, smoking illnesses as well. What message, how will it resonate, particularly with the Black and Brown community, that this is real, this will kill you, and you need to pay attention to it, given the socioeconomic dynamics that are faced in the Black community? Dr. Carter, would you like to start with that?
Well, I get calls every day now. We've been sitting here for the past month, screening calls from people who are concerned now. So there is some awareness going on and among some of our folks in the communities about their risk. I mean, a month ago, that didn't happen. A month ago, you could go to neighborhoods where people are walking around with nothing, no concern. And even now that there's a big push to sort of have social distancing and to wear masks, even now, a lot of people don't do that. A lot more are, but not enough to make, to get us where we need to be to sort of reduce our risk of getting this disease.
Mm-hmm. Reverend Dr. Hammond. Jeff, we have Reverend Dr. Hammond on mute. So if we can take her off mute so that she can respond, that would be wonderful. So if we're working this through, all right, and we can just take her off. Jeff is on it. You're good to go, Reverend Dr. Hammond.
Great, thank you so much. Yes, as my friend Jacques and colleague has said, even with the warnings, and again, many people have become more sensitive, still too many people are taking chances in a sense, and because when we're interacting with people who don't seem sick, then we think that maybe they're probably not sick. You just don't know what you just don't know. It was interesting, a couple of days ago, a report came out looking at people who are homeless at Pine Street Inn. They did testing on 400 of the individuals. A third of them, 30% of them were positive, but they had no symptoms. So 130 people who, because of their circumstances, spend time outside and they have no symptoms. So we don't know. We can't tell by looking at people who actually has the virus.
Yeah.
We absolutely need to find ways to social distance.
What needs to be done on the governmental level to heal a fractured community? Before this, we had demonstrations, we had issues with the police department. We talk about Black Lives Matter. We had people who were killed by the police. And we have lots of incidences that makes the public suspicious of partnering and collaborating with law enforcement, elected officials, et cetera. With this, in the wake of this virus, can you give us a sense of maybe where we need to point, what we need to do in light of the history of our communities and the racism and the oppression that we have faced? Dr. Carter?
Sure. Yeah, there's not a community in the state where there's a significant African American population that has not looked at issues related to health and social determinants. And everybody's working on this, but we don't make good moves with it. It's almost as if what's going on here in Boston doesn't happen in Springfield and Worcester and other places. We need to find a way to convene a big group to deal with the issues. I mean, right now it's clear, it's glaringly clear that we've got problems in our communities, and they're health related and they need to be addressed. And I think that something needs to be done to bring that out. And I think that we've got to find a way to put bodies together, to bring the public health commissions and the city councils and all the other groups together to deal with the issue. And it's very important. If it doesn't happen, there will be another pandemic at some point. And we'll suffer the same way then as we are now if we don't take care of that.
Yeah, and I think, first of all, the people have to tell the truth. They have to give us the data. And right now, we don't have sufficient data. So we have to know what is happening in real time in order to hold people accountable. And again, in owning what's happening now in the context of the history, naming racism and the extent to which it still prevails in this society. We have lots of reports, and it's time to really do some of the work, diversify the tables, even in the midst of this issue, that there needs to be diversity in terms of how we come up with, how we even address the disparities in health. So some of this is not new. But we need to hold people accountable in terms of having the actual will to follow through.
I'm going to take you way back before our time, but certainly not before our parents or our grandparents' time. I remember my mother talking about my grandfather and his eyes that were affected by this incident that took place and had to see a specialist because of it. I'm going to do some research on it, but I want you to take us back to the Spanish influenza in 1918, right in the midst of World War I. And that's really, I would say, the predecessor in terms of a pandemic to what we're experiencing today. What's amazing to me, Reverend Dr. Hammond and Dr. Carter, are the similarities with what we're facing today. Can you talk to us on that level from a medical perspective?
Sure.
Well,
Reverend Dr. Hammond?
Sure. Well, as you indicate, that was the last pandemic, and much like this pandemic, it caught us off guard and had the same worldwide calamitous effect. There were some things that were different with this particular. With COVID-19, it primarily attacks people who are 65 and older, and then people again with those morbidities. But in that epidemic, there were actually children under the age of 5, young adults between 20 and 40, and then again, people who were 65. So some of the prevalence was different. What is similar, though, is that like we have now, there was no treatment, there was no medication, there was no vaccine. So some of the same things that we're doing now, we learned to do during the 1918 epidemic. We learned about the importance of social isolating. We learned about not coming together, learned about sanitation. So some of those things that we did then, because we did them then, we learned the difference. We're doing them now as well.
Dr. Carter? Yes.
The numbers were staggering in 1918. We had 500 million people infected around the world, and probably lost about 50 million, which is just unbelievable numbers, almost like the Black Plague from the Middle Ages. And again, the people who made mistakes back then, cities that had parades and other things like the Philadelphia and St. Louis, they had a different group of people dying because they were too close together. So we understand that, and we just have to. This is not 1918. We got a lot more that we can do nowadays than they had in 1918. But the similarities spread the same way. It was called the Spanish flu, primarily because people thought it started in Spain, but it probably started in Kansas,
right,
in the United States, and just spread around because you had the war going on, and people traveled, and they were all together, and in trenches, and sanitation wasn't that good, and that's why a lot of young people died in that. But you had soldiers and recruits, 17, 18, dying because they got that, and they died in two days. Sometimes a day.
I think the other thing that's significant about that flu is that really for decades, people have said that any day now we could have another devastating infection like this. So this is, there are people who have dedicated their lives to having cultures, countries be prepared for such a thing as this.
Mm-hmm.
Once again, the alarms have been they've always been out there.
Right.
People got caught off guard, and because we dismissed it as something that was over there, and for other people not like us, here we are.
I want to bring up, we have great listeners on Facebook, I think nearing 100 plus at this point in time. We have questions and comments that have come in. I want to just share with you a couple of them. Peter Lynn Marcus says, thank you for holding this important conversation. And we also have a comment from Ioma Remus, and she says, thank you for holding this discussion. I am a nurse who works at Mattapan Community Health Center. So clearly understand what's taking place. Kelly Chung, who we know, a wonderful businesswoman in the area, she says, does anyone remember former U.S. Surgeon General David Satcher 10 years campaign to highlight and reduce healthcare disparities among Black and brown people, and it never should have ended. She says, we also need grassroots distribution of free masks and sanitizers, hand sanitizers. Who would like to take that on in terms of that kind of suggestion?
Sure. Well, there are definitely growing numbers of efforts to make masks. I've encouraged some of the sewing circles at churches to make masks, because there's some things that you can sew, and there are places online where you can get directions in terms of how to sew those things. And the city is also going to begin a campaign, a door-to-door campaign, again, just educating people and giving them kits that include some of those items. The thing that we haven't talked about that has also been absolutely irresponsible is the availability of tests. Just the fact that we are not able to test people is unacceptable. That we are rationing tests, and that people there are not enough swabs. This is the United States of America, mm-hmm. And if it is as great as we think it should be, and with our expensive medical system, the fact that we have to ration tests is just unconscionable.
Dr. Carter, I'm shaking my head. I'm in agreement with you, Reverend Dr. Hammond, that it's abominable.
Yes.
Dr. Carter?
Not just rationing the test, but there are a lot of the testing sites are now drive-through. They're mobile testing sites. I had an email today from one of my staff members here. Now, we, at this institution, we've set up multiple testing sites in Dorchester, at Bowden Street, and in Chelsea, here at the hospital. We've got the sites, but these are drive-through sites. And I had a note not from one of my patients, but one of my colleagues said, I've got a patient who doesn't have a car.
Absolutely. That's
right. How do we get her to be tested? And somebody said, well, get Uber. And they said, no, because the government said you should not do shares. There should be no share riding. So this poor lady, if she doesn't have a friend or a relative, can't get tested, even though she met the criteria to be tested. So that's
wow.
We've got to find better ways to do that.
Wow.
And I think that underscores why it's important to have diversity at the table.
Yes.
Coming up when you're understanding the problems and coming up with the solutions.
Reverend Dr. Gloria White Hammond and Dr. Jacques Carter, you have opened the door for the rest of our conversation, and particularly that last point, drive-by testing sites with no car and refrain from using Uber, taxi, whatever. We're going to pick it up on the other side. We thank you so much for your comments. I know you're going to stick around. We'll have another round of Q&A, and then another robust round at the end. So we want to put our hands together, snap our fingers, and say thank you very much to Reverend Dr. Gloria White Hammond and Dr. Jacques Carter for an amazing conversation with us. Thank you so much. Thank you. We're going to bring on board now our next panel we're just going to pick up and keep going and talking about the on-the-ground organizers in the Black community. These are the people who look at what our physicians have said and they're making things happen. They are rattling the cage. They are making people aware, and they're definitely organizing. First is Tito Jackson, and he is recovering from COVID-19. We're going to talk to him about what that experience has been. He is the former Boston City Council member, ran for mayor, and also is now, I believe, still the chief executive of Verdant Medical. Is that correct, Tito? He's shaking his head yes. Thank you so much. We also have Vanessa Silva, and Vanessa will introduce herself and give you more information about her. We have Dr. Atiya Martin. She is here, and let me see if I can pull up her information as well. Dr. Atiya Marshall is the former Chief Resilience Officer for the City of Boston. She is the former Director of Public Health Preparedness for the Boston Health Commission, and she is a certified emergency manager who is internationally recognized for her speaking expertise, confronting racism and advancing racial equity. Thank you so much for being with us. We have Yvette Modestant, and I'm going to pull up her information too. Yvette is a writer, a poet, an activist, and was born and raised in Cologne, Panama. She is one of the 30 Afro-Latinas you should know. Ms. Modestin is profiled in the Boston Globe as a uniter for her work in bringing the Latin American and the African American community together, and for her activism in building a voice for the Afro-Latino community. We are very glad to have her. And last but certainly not least, we'd like to bring on the Executive Director of City Life, Lisa Owens. We welcome all of our panelists. We want to make sure that all of them can be seen. That would be Tito Jackson, Vanessa Silva, Atiya Martin, Yvette Modestin, and Lisa Owens. So if you hear your name, make sure that you are now off, your camera lens is off and we can see you. We thank you so much. The one person I'd like to make sure is Vanessa with us. Vanessa, are you with us? I don't see her, so maybe she'll join us later on. But let me start this off. First of all, Tito, I have to go to you. Let's take yourself off mute too. Jeff, you may need to help us with that. That would be Tito, Atiya, Yvette, and Lisa. Just make sure that they're off mute. You can unmute yourself. Yep, great. Atiya, can you unmute yourself? Jeff, we may need some help. There's Lisa, awesome. All right, Atiya. Jeff, we may need some help with Atiya and Tito, because they're still muted. Tito is now unmuted, excellent. And Atiya, let's make sure that we get you unmuted. You're great there now, 100%, awesome. All right, Tito, how are you? Tell us about the experience. Thank God you've lived through and you're talking to us about COVID-19 on the other side.
So I'm doing well. I'm honored to be here. I'm also honored to be in your presence. Carol, you say my name just like my mother. Normally when I'm about to get in trouble, so I was a little shaky for a second, but I feel wonderful. I would say to you, my illness was actually considered a mild illness. Mm-hmm. Sadly, mild in this case is not good either. But I would say I was blessed to be able to stay at home. My illness actually started on a Saturday of the Saturday evening of the 14th. I started with a sore throat. And then began to have a cough. I actually had a sore throat, went to an event that had 4 or 5 people. Then one of my friends said, hey, I'll give you some soup. And went there, and then I just shut it down after that and went home. And so from the 15th until I think last Wednesday, I was actually quarantined. The third day was a fever, as well as headache. But then in the 4th day, I started having the worst body pains I've ever had. I felt like I got beat up several times over. I lost taste, I lost smell, and then I ended up having shooting pain through my joints, through my ankles as well as my knees. And at that point, I contacted my doctor. He reminded me I did not take a flu shot. So I actually began getting treatment with Tamiflu initially. I'm not sure why, but it did actually help me with some of the pains. And then the next week on Monday, one of my friends informed me that she had a positive case, a positive identification. So then I went to Kearney Hospital and got the test at Kearney Hospital. So I was about a week and a half into my illness and kind of on the downside when I was able to get the test. And I will tell you that is the largest Q-tip I've ever seen in my whole life. And I initially thought it was going to go in the back of my mouth, but it reminded me of when I learned about the Egyptians taking the brain out through the nostrils. And yes, so, but I would say, one, we need to advocate for ourselves in terms of the testing. We need to fight for our ability to test. And I guess, and I'll toss it to the amazing other panels, but I would just note when we talk about underlying or pre-existing issues that we have in our community, I think it's critical that we not and the doctors outline that aspect of it, but we have to talk about poverty, redlining, gentrification, food deserts, healthcare disparities, distrust of the medical community and the Tuskegee syphilis experiment, which went on for 40 years. We also have to talk about environmental racism. Bartlett Yard was in the middle of our community. I live in Grove Hall, and we have some of the highest, we have 6 times the rate of asthma that other parts of the state have, as well as systematic racism. So these are the underlying and pre-existing conditions that have presented the conditions that have given us the disease states and disparities that we have. And I think it's critical that we deal with that. Lastly, one overlay, we are still losing our babies in our community. They're getting killed. So if we were to do the overlay of violence on top of this corona map, I would submit to you it's probably the same mapping when we look at the babies that we're losing in our community.
You said that, and in our congregation just yesterday, a young great niece was shot and killed, 17 years old, on the streets of Boston. So that continues. I'm amazed because everybody is supposed to be at home, and that kind of violence, senseless violence goes on. Well, you've opened up a big door. I want Yvette, can you pick up on that? Yvette, now you're still on mute, so we're going to take you off mute. Yvette, can you pick up on what has been said, particularly since you're looking at the African-American, the Black and the Latino community? Talk to us about this situation that we find ourselves in.
Well, thank you for inviting me to join this amazing panel. And I feel like we're almost going to be repeating ourselves because many of us overlap in the same spaces. But first and foremost, I want to uplift the strength of our community first, our internal strength, and leaning on the resiliency of the ancestors that of whose shoulders we stand on, and to acknowledge, not to only start the conversation from a point of weakness, but from a point of our own internal strength. So in saying that, the community was not ready for this. The community was absolutely not ready for this, but we knew this was there. We knew this would happen based on what Tito has just said. The Boston itself, it was very specific, and Atiya, Dr. Martin can speak on it, but she did that report when she was in the mayor's office that spoke about all of these things happening, that the system was broken here. A year ago, we were told that the economy in Boston was for people of color at $8. So we knew that when something like this hit, we were not going to have the economy, the money to even buy basic food needs. So we already knew the system was broken. We know that the system was not seeing who we are and dealing with us, specifically to Boston. Boston mayor that is sitting currently got a D, on how he was dealing with the communities of color. Let's not forget that that all has to do with why this is impacting the community the way it is. What we are seeing as an organizer, working with youth, as a clinician, is that it's impacting food access. Yeah. Folks, parents were supporting or leaning on the schools for their kids to get full meals for breakfast and lunch, and knew that they would only have to cook dinner or something like that. Now they're having to cook 3 meals for 2 and 3 kids with only getting a child support check. We have our elders who only live off our SSI, and that's what they pay their rent and do all their bills, and they sort of cover up the cost of food and stuff by using food pantries. That's not an option now. They can't leave the house. They can't get to the food pantries. Keep in mind, we talk about, okay, we can work at home, and it's so easy to say it. A lot of our families did not have access to the internet to be working at home. Our young people, although they got the Chromebooks, may not have had the internet to even do it. We are 5 weeks in, and I know of some of my young people who are still in need of hotspots to connect to the internet to be able to do their schoolwork. Housing, I'll leave it to Lisa to speak more about, but we work in collaboration with our housing issues. You have folks that we're still fighting for the governor to pass the monetarium on the rent and the mortgages. Why are we 5 weeks in still asking for this to happen? And you're seeing the impact of the numbers. We are seeing folks that have no income coming in because, like the Dr. Hammond said earlier, places like Chelsea, where they are the folks working, places like Dorchester is getting hit. Those are the restaurant workers, the everyday workers that now with everything shut down are not getting a single penny coming into their homes. Unemployment. It is not easy to be on the phone for unemployment. And people are sort of like, oh, go to the internet. Let's not, this is showing the classism. This is showing the racism. This is showing the racial divide. Boston is on blast right now that it is not serving the community of color in the righteous way that it should be. And we cannot continue to, oh, okay, but you did this. No, you're not doing this because our numbers are showing that it's not being done. And then, my last piece, because I have my 2 other colleagues that are coming that can fill in the gap, is that as a Black immigrant Latina woman, I'm a Black woman first and foremost. When I get on the bus, people don't know that I was born and raised in Panama. And there are many people in Boston walking around like me. Although the Latino community, the largest Latino community in Boston is a Dominican community that is of African descent, but does not self-identify. We need to pay attention to the fact that I do not fall under Latino numbers of the impact of the virus. I will fall under the numbers as a Black woman. So how are we going to treat Black Latinos or identify Black Latinos within the communities that live in predominantly Black African-American communities that are not getting served? And then the language barrier. If we have such a population that is so big of people of African descent, everything needs to be done in all the languages that are represented here. So those are some of the things that I think, we need to pay attention to. As a reparations commissioner, I cannot help but say, this is about reparations. This is about reparative justice on all layers of a system that has not seen us in our human life.
Well, we have more on the table that Yvette has so eloquently put on, started by Tito Jackson, and she has continued on. The conversation is now really getting where we should go in terms of the real issues, having started off with our medical professionals. Lisa Owens had to depart. She had another engagement. I am personally going to invite her back because we're not just doing this. This is not a one and done. We're going to do this again in 2 weeks at the same time. And we'd like to have the executive director of City Life to come back on the air with us between 7 and 9 to do part 2 of that this particular discussion in this program. Also, if you are watching, which you are watching live on Facebook, we'd love to get your comments. We're collecting them. We'd like to have a Q&A session, obviously, after this particular segment, and then another one at the end. So please put your questions down or your comments down in the comments section of this live broadcast on Facebook. Or if you're watching on YouTube, you can do that as well. Atiya Martin, please jump on in, talk to us. You've been in this space in terms of being a public health Commissioner. What is the perspective from your standpoint, just based on our conversation to date?
So first of all, I want to say thank you for having me on, number one. Number two, that I was the Director for Public Health Preparedness at the Boston Public Health Commission, which basically means that I led the emergency management planning, response, and recovery for the city of Boston for public health, but also all of the healthcare infrastructure in the city of Boston. And so that's the lens and experience that I'm using for this conversation, as well as the importance of embedding racial equity and social justice into that. So the first piece is Dr. Carter said something in the beginning. He said, he was talking about the social determinants of health. And I want to build on that because the biggest social determinant of health, and this is what COVID-19 is uncovering with extreme clarity, is race. And not just because of race, but because of racism. The biggest social determinant of health is race because of racism. And in these kinds of disasters and emergencies, race then also becomes the biggest social determinant of vulnerability. Who is going to suffer disproportionately the worst impacts and outcomes from emergencies and disasters? We've seen this time and time again. This is not new. And just to give people concrete resources to look at, because I believe in information, knowledge to support our critical thinking, we've been through this before. H1N1, we did that in Boston. We stood up large scale clinics across the city of Boston and vaccinated thousands and thousands of people. During the Ebola virus, we worked with healthcare infrastructure across this city in order to coordinate resources, knowledge, information, and manage federal funding that came in order to help us coordinate that response. And our office's role was to make sure that vulnerable populations, especially people of color, were receiving the benefits of those investments. And then the last thing I'll mention is the marathon bombings. Now, most people saw that as something that only impacted white people. There were some people of color who were directly impacted by the marathon bombings, but I bring that up because it also was another disaster that highlighted the glaring inequities, racial inequities that we have in the city of Boston. While all of those millions and millions of dollars of support and resources were coming into the city for survivors, we saw the highest increase of gun violence in the city of Boston on record than we had ever seen, and we have still yet to see. And at the same time, millions of dollars of resources are coming in to support the survivors. I bring that up because responsible people were looking at that as an issue, and we were able to take Homeland Security grant money and make sure that community organizations in the city of Boston actually got additional funding to be able to help be part of the team to support the ongoing mental health and community service needs that our communities needed after the marathon bombings and for the foreseeable 2 years after that while I was there. I say that, all of that, because we have a lot of fire alarms in our community. And what I mean by that is people who can call out all of the things not working, not going well, but we need them. But we need more firefighters. We need more people who are going to get on the ground and who are going to come together and not be gatekeepers, to be able to collaborate so that we can actually pool our knowledge, our resources, our talent, our energy, because we do have a lot of that, to Yvette's point earlier. We have a lot of power that we are not tapping into in order to address these issues. And so for us to be able to have the kind of change, and this is going to lead into the next conversation you all are about to have, in order for us to have the kind of transformational change that we need, we have to change our mindset. We have to change how we understand these issues. We have to change how we see each other, stop competing with each other as Black people, and start figuring out who are the folks who maybe we just need to go around them, over them, under them, just move them out the way, so that those of us who are willing to collaborate and partner, get our hands dirty, and take the love that we have for our community and put it into action. And so the last thing I'll say is there's a quote that I'm not going to remember the gentleman's name who said it, but it is completely and totally appropriate in this space. And it's, "Thou shalt not be a victim, thou shalt not be a perpetrator, and above all else, thou shalt not be a bystander." So for us, as we look to figure out what is happening, what we need to do moving forward. Please don't think that there's nothing that you can be doing. Start with yourself, start with your own household, do the things that we can do. And when the opportunity we have as Black people in Boston is that when we are able to collaborate, when we are able to get all of the stuff that's been in our way from working together in the ways that we need to, instead of competing, we won't see situations like an elderly woman who needs to get to an appointment or needs to go to a drive-through testing site who can't get a ride. Why? Because we would be collaborating and making sure that we're checking on our own people and not waiting for government to get to government's table to sit at that table. We need our own tables. And what happens when you have your own table, they have to come see you. They have to come see you. So let's do the things that we need to do to move the needle forward. And the last thing I'll say is if you're interested in learning more, please visit intentionallyact.com. That's where we're posting information on COVID-19, the intersection with racial equity, as well as other resources and tools from credible sources so that we can make the best decisions for ourselves and our families.
Carol,
Before we move on, Atiya, I want you to repeat the affirmations that you said a few minutes ago. Would you repeat that for us?
Yes, ma'am. Thou shalt not be a victim. Thou shalt not be a perpetrator. And above all else, thou shalt not be a bystander.
Thou shalt not be a victim. Thou shalt not be a perpetrator. And above all else, thou shalt not be a bystander. That's going to be such a great segue when we finish this segment into our next steps. Thank you so much for that. Tito Jackson.
So first off, these sisters, I'm just in the presence of greatness with the three of y'all. I'm over here, but one of the things I also want to bring us back to a time in our history as Black people. Well, we pulled it together. So December 5th, 1955 to December 20th, 1956, 1 year and 16 days. That's the Montgomery bus boycott.
Yes.
Right. And so there's no Uber, there's no Lyft, Verizon, AT&T, and all that stuff wasn't around. When you dialed a 9, it took about 15 minutes for the 9 to come back around on the phone. but we had it together, and we created a shadow transit system for our folk to get around, get to work, and there was no such thing as working at home at that time. And so I also did want to pick up on Atiya, and by the way, we miss you in the roles that you're in. We're happy that the roles that you are currently in, but we miss you, and I'm so happy to see you in this space, and again the work that Yvette does. But I also believe that we have opportunities, and I know we're going to be moving into that, but from a city sector, it is critical that we understand that supporting Black-owned businesses equals supporting Black public health. When we hire each other. And so when we look at a budget that has $600 million spent, over $600 million spent in discretionary funds in the city of Boston, and 0.5% of that is spent with women and people of color together. These are ways that we can look at the new normal. And I would submit to you that the old normal was killing us. The old normal that we were in, when folk are talking about, hey, we want to go back to normal or whatever. We live in a city, my district as a city council, from Roxbury to Back Bay, at the tip of the Back Bay, we have prior to this, a 33-year difference in life expectancy.
Wow.
In Back Bay, the life expectancy is 91.9. In Roxbury, the life expectancy and parts of it are 58.9. That 58.9 is lower than the life expectancy of Iraq as well as Cambodia. That is, again, another pre-existing condition that we started with. We are resilient, but it is critical, as Atiya brought up, when the bombing happened, millions of dollars poured into the city. there was trauma work done all over the city, not really in Roxbury, but in many parts of the city. And so it is interesting to see whose crisis it is and what resources go to who. And if we can't agree that having 40% of these, actually, when you look at this, probably over 70% of Black and Latinos who are the ones getting this and dying from it in the city. If we can't identify that as a crisis today and direct resources at this, then I don't know what and when we would ever do that.
Wow. Yeah. Yvette, and then we have so many comments. We're not going to be able to get to all of them, but the rooftop is off. And Tito, you talked about the Montgomery bus boycott. The architect of the Montgomery bus boycott was my very, very dear friend who passed away in September of 2019, Juanita Jones Abernathy. This was her funeral program. I spoke at her funeral. She's my shero, definitely my shero. And what they overcame with no technology, in fact, they had to use mimeograph machines to run off the flyers to get people to the rallies. It went on for over a year. And that was the beginning of the modern day civil rights era. Thank you for lifting that up. Yvette, you're on mute. So we're going to take you off mute. I know you had your hand up. All right. Can we take you off mute? Maybe Jeff needs to give you a hand and help out.
Oh.
Thank you. You're good.
I didn't want to, I'm going to put my clinical hat on. I was a trauma responder for the city for 3 years when one of the first group that came out. And one of the things in the midst of all of this is the well-being of our community. I've spent more time, trying to work on getting the resources in place, but also to stabilize the well-being and support folks during this time. It is very difficult to be stuck in a place for a lot of people. It is very difficult to not just go outside and take the air and, feel the sun on your skin. So, we need to, connect in new ways and be creative. Atiya and Tito both talked about how creative we are as a people, and we need to be creative in how we take care of our well-being, our physical and mental well-being, and our spiritual well-being, because this is shaking us all up. And I want us to not speak of as if it's something outside of all of us that are on this panel. This is about us. We are being affected by it also. It is difficult to do the organizing, the community work that is needed when you cannot see people, when you cannot touch people. So we are every day having to learn new ways to really connect with our community in these times. So let us, all layers of this, that is showing up for us, let us try to tap it and collaborate, as Atiya said, as best we can with all these portions that are showing up for us in our community. And that we know that we come from a people of greatness, that we come from a people of brightness, that we come from a people of love, and that has to come hand in hand with what we are doing here and how we are going to move past this.
Your statements are so profound that we're just blowing up in terms of comments and questions. Gwendolyn Brown said, "This is what our people need to hear." And Ruth Hines says, "Prevention is so hard to sell." Helene Levin says, "The governor needs to issue the allowing of groups 10 or to congregate. Please call him." That's her opinion. That's her comment. She said she did, but I want to put it out there. That's a comment that it has been made. And other comments include Joseph Rocha, Reverend Joseph Rocha, who says, "Because in our Black and brown neighborhoods, we were not even on the playing field. And one has already said about the income disparity between the white family, $260,000, and the Black family, $8. That's the net worth in the Black community. So the disparities in all aspects of our lives, healthcare, employment, education, housing, training, and wages are amplified. So why can't we develop a collective of organizations and individuals to deal with all of these issues. Remember, to those who have joined us, the New Democracy Coalition, we are recording this event and it will be viewed immediately afterward on our Facebook page. It's going to be kept there into perpetuity. And our website, thank you for bringing this up. The website is www.thedemocracycoalition.org. So we thank you for that comment. Let me read another comment and then we will hear from our panel of experts before moving on to round 3. This was from Ryan Walker, and as a resident physician, I'd like to add to the conversation that the general population should know that the COVID-19 test is not 100%. There have been as high as 30% of people with symptoms that test negative. So it's important that if people have symptoms, they listen to their bodies and try to implement the precautions as much as they can, even if they test negative. Tito Jackson, you got to take that one. I'm already thinking about the big Q-tip and the nose.
Well, one of the other, so one, absolutely listen to your body.
Mm-hmm.
2, I would also say to you is one of the things that we live in multi-generational homes also.
Mm-hmm.
In the Black and Latino community. And so if people aren't, we think about our own well-being and safety, but we're very likely to pass this on to someone who, I will also say it is not comfortable to have to call all your friends and tell them that you possibly have given them a life-threatening illness. I did that because it was the right thing to do, but it is an uncomfortable conversation to retract the last time you saw them, how you were feeling at that point, and the like. So that is absolutely critical. And I appreciate the doctor basically saying, by the way, science is science, and doctors are taught about the body. You know your body. And you know what your baseline is for your body, and it's better absolutely to be safe than sorry. The last piece I'll toss in is this shows us how important state and local leadership is in our country. We have a governor in Georgia who doesn't know what a damn CDC is because he drove past the CDC. Went and did a press conference and said that he didn't know that people could be asymptomatic, right? And he was steps away from the CDC at the time. You have people who are trying to, and I'm glad this is not the state of Massachusetts, but who are trying to open up and put our public health behind the economy, right? And say that the economy is more important. Your state and local leaders mean more than ever now. And so it's absolutely critical that one of the ways, and Atiya was saying, build a table, having a table with the current ones that we have, expanding those seats and expanding those voices and expanding that power, and fill out your census form.
Thank you for saying that. Thank you so much. I'm going to take one more question for this comment, this segment. Again, we're going to lift all of this. This will probably be part of part 2 in 2 weeks. So if your question doesn't get answered, don't get mad at me. There are just so many of them. And we want to make sure that we get all the rest of our speakers on, that we're going to take care of this and talk about it in depth on April 30th. But the last question from Thaddeus Miles, who I know, he says, what do you think of the city having a Black task force and a Latino task force? I'll ask in 30 seconds to have both Yvette and Atiya to answer that question from Thaddeus. Yvette, can you start?
Oh, I think that would work. I think we keep sort of doing these things as 2 separate components when both the communities live amongst each other, are in, yes, there is the language piece and the cultural piece, but as a Afro-Latina, people of African descent come in all shades, and that includes the Latino community. So when we talk about this brownness, it's also what is the root of who they are, and there is an African presence in that. So if we can sort of have that conversation, call that elephant out in the room, the internal racism that exists within the Latino community, name it, you know, because that also is in there to name it. Then I think if we created those task force, we would be able to see each other better and work more collaboratively.
Great, great. Thank you. Atiya.
Only thing, so I agree that we need to come together. I think the idea that the mayor having a task force is not necessarily something that is in action.
Yeah.
It is something that happens often. And it's an example of what I meant earlier around you can be at their table and they will just ignore you and they will check off a box to say, yeah, you were at the table. So, you know, don't complain about the outcome of this thing. And so I want to be explicit that yes, and that task force has to be doing things beyond what's happening with the mayor's office. So if it's convened by the mayor's office, then that means the mayor's office ultimately is controlling that space and the agenda and all of the things that are part of power building. The other piece is this idea of collective care. I know we talk a lot about self-care, but one of our key values as people of African descent, regardless of where you landed on the planet, is this idea that we are not just about ourselves, that we're about taking care of each other and holding each other accountable for taking care of ourselves and each other, and that they are not mutually exclusive. And I bring that up as we transition to what the future can look like. The last thing I'll say is I just want to let everyone who's watching know that we see you. There's a saying in the isiZulu called Sawubona, which means I see you, but not just in a regular English way of seeing someone with their eyes, but it's an acknowledgement that not only do I see you, my ancestors see you, my entire community sees you, the universe sees you, we value you, we love you, and I am a witness to you being in existence. We appreciate you. Please hold on while we're in the midst of this crisis. We can support each other. We will make it through this. We make it through everything else. It will be hard, but we will make it through together as long as we practice collective care.
And to close up, yes, Tito. Yes.
I just want to give a shout out to Violence in Boston.
Yes.
And Monica Cannon Grant, who is also someone who's showing how this works. They fed over 30,000 people in a small restaurant in Grove Hall. Violenceinboston.org. If you have an opportunity to drop some love into that is an organization. They started it for 1 week and now they're going on 3 weeks and having been able to feed over 30,000 members of our community. And that's one of the things that Atiya was just talking about. Thank you.
Violenceinboston.org. That's violenceinboston.org. Thank you so much, Tito Jackson, also Atiya Martin and Yvette Modestine. Awesome job. Awesome job. We started off with awesome medical doctors, and now we have this awesome panel. And I want to read this again because I wrote this one down. Thou shalt not be a victim. Thou shalt not be a perpetrator. And above all, thou shalt not be a bystander. Amen. And that's going to lead us to our third panel. Thank you all so much. They're just going to disappear. They're not going to disappear from the program. You're just not going to see their faces, because now we're going to bring on our third panel talking about the vision and the plan of action for the Black community. The founder and the executive director of New Democracy Coalition of Massachusetts, Kevin Peterson. This was really his brainstorm. We'd like for him to take himself off his camera. You can start your video and unmute yourself. We also have from the University of Massachusetts Boston campus, and let me give you a proper introduction. I have a little bit of information here. Great. We will have the founding director for the Center of African, Caribbean, and Community Development, the former dean of Community and Public and Community Service and faculty member of the Africana Studies Department at the University of Massachusetts, Boston. That is Dr. Jemadari Kamara, who I have known my entire life because we are both from Detroit and we lived around the corner from each other. That's how small the world is. We'd also like to introduce to you our third panelist. And again, you can take your click where it says start camera we want you to do that. We see Kevin. Kevin, you're here. Awesome. So Jemadari Kamara, please start your camera and take yourself off mute. Jeff may need to help with that as well. We'd like to bring Savina Martin on. And Savina is there. Hello, Savina. I have information for you. She's a lifelong national organizer and poverty scholar. She holds a master's degree in social sciences as well as an honorary doctorate degree in humane letters of Our Lady of the Elms College in Northampton, Massachusetts. She grew up in Roxbury during the urban and social upheavals of the 1960s and 70s, busing riots, and she is a U.S. Army veteran. She's a bad sister. Savina Martin, thank you so much for joining and being with us. And we have Dr. Tony Vandermeer. Tony is a professor at the University of Massachusetts in Boston. We are very glad to have you. Tony, would love for you to click start video and take yourself off mute, and we will begin our conversation. There he is. Thank you so much. Another distinguished panel. Great folks. You've heard it. Now, we've gotten folks riled up. The questions are definitely there. We want to know, and the first question, I'll start with perhaps Dr. Jemadari Kamara. What is the responsible role? And let me move on. That question was for segment 2. Would be asked for this segment as well. Very open-ended question. You've heard Tito, Atiya, Dr. Gloria White Hammond, Dr. Jacques Carter. They have all, Yvette, they've all laid it out there. Where do we go from here based on the issues and the circumstances that we're facing? Jemadari Kamara.
Thank you very much, Carol. When I was asked to be on the panel, I really hesitated because as we're speaking about this issue of COVID-19, I have felt in a precarious situation because as I've watched the television accounts of this, and they began to talk about all of those criteria of those who were in the group that was in the highest risk, those who are above 60, those who have a prior medical condition, those who are African American, those who are male. They're talking about, and I am not a medical doctor, but the sense of having been identified as being in this high risk group has forced me to consider the complexity of the issue that we're dealing with. They're not simple answers. Yes, we have the immediate concerns. Just as Tito was talking, when you're ill, you want to go to the doctor and you want someone to take care of you, your physical body. But as I thought more deeply about the consequences of where we are, that I have been in that high risk group all my life. And my father died in his 50s, was in that high risk group. And the work that we have done at UMass Boston for a number of years, and I hope in the future on some of the future panels that you will hold, can refer to some portion of that body of work that we did for more than a decade, which was focused on health education and learning. It was a program that we initiated focused on Black male health and focused around the state. And while indeed we addressed questions of heart disease and diabetes and prostate cancer, we held sessions on this. We also, through that process, learned ourselves. And one of the most interesting lessons came, and I think it's directly applicable to where we are now, is that in one of those sessions, we focused on the question with a national organization on the question of suicide. And During one of the years in which we were engaged in this project, one of the unspoken data factors was that the suicide rate of Black males in Boston was higher than the homicide rate.
Wow.
And we don't speak about it.
Yeah.
And this issue of PTSD came to the forefront. This continued dynamic of stress, not just in its medical sense, but the stress of our lives, of living as a Black person, particularly in a city like Boston. And the kind of stress for survival that exists within each of us and that we feel in any number of ways in our daily lives, compounded by years of living in that kind of an environment. And we did this work through the center. And unfortunately, after a period of time, it was no longer funded through the state. Mm. But this is the kind of long-term work that we need to be able to do, because the complexity of the problem deserves a complex analysis. Mm. It is an interdisciplinary kind of analysis of the problem and aggregation of data, not just medical data, which is extremely important, but we need social science data. The participants have talked about earlier the complexity of the social, economic, and political consequences on our community. And to address the issue, we need to be able to work simultaneously at multiple levels. It is the unfortunate reality of our lives that we have to move that way. But in order to deal with this long-standing issue, we are going to, as we move forward, have to move at those multiple levels in addressing this. And as we looked at this question of PTSD and the implications of that on our community, one of the structural factors, we just got through talking about racism and its implications, and I'm glad we talked about this issue of racism in relationship to COVID-19. And we talked about powerlessness in relationship to this dis-ease in our bodies and in our communities. Part of that dis-ease is the inability we have to trust one another. PTSD is a consequence in a manifestation through stress that we see. But PTSD is also the post-traumatic slavery disorder.
Yeah. And you know what?
And that speaks to our relative relationship to power that has historically moved us out of slavery, yes, but into being sharecroppers, and then migrant labor, and then day workers in the factories in the North. And our relative relationship to powerlessness has remained the same. So we need to be able to address this at multiple levels.
That Jemadari Kamara is going to also be tied into our April 30th segment that we're going to have, because it is such a large, important component of what we're talking about that we're definitely sort of put a pin in it, and we're going to continue with that stream of consciousness during April 30th. So we're going to continue on with Savina Martin, now that you've opened up a bigger door for us to walk through. Savina, talk to us about where do we go from here? What are your thoughts about what we should be taking action on now?
Well, first of all, let me thank you all for inviting me here with this amazing group of distinguished colleagues. I just feel like this is not only timely, it's necessary.
Yes.
Right? It is very necessary. Following this last piece on post-traumatic stress disorder, as a United States Army veteran, I saw that in its full form. But aside from that, the community that I grew up in, Roxbury, Dorchester, Mattapan, we are seeing the effects of traumatic syndrome because of the war-like zone. We've come through so much. And let's take it back a little bit further when Plymouth Rock landed on us. We witnessed the exploitation of labor, of bodies, right? We came through that. But did we really come through it? We came through part of the civil rights movement, which was disrupted with the assassination of Dr. King, which I witnessed as a little girl, looking out of my window, right? Seeing the National Guard across the street from my house, watching my mother stare down the police because they were going to stone her.
Wow.
So we witnessed many, many atrocities compounded by the destruction of the Black and brown bodies and community, whereby right now, this pandemic has unveiled and shed light on the centuries of fissures and breaches and crevices of endemic injustice and gross inequities. And we need a coordinated team of first community responders to respond to this now, not tomorrow, now. Sisters talked about critical thinking skills. We need to put all of those skills together. But what does our community need right now? We are standing on the heels of many crises, unresolved crises, mass incarceration, the drug epidemic, homelessness, a lack of health care. These are all due to the systemic and structural causes of the type of system we're living in. And they know that is true. We've just got to realize how serious it is and come together with our beloved community and do something about it. Now, it's easy to say to do something about it. It's easy to say that. But here we are right now at a table that we refuse to sit or set for anyone else. Eat from.
Right.
We're seeing work like Monica Cannon Grant. She works tirelessly to feed.
Yeah.
But should that be this sister's responsibility? We have all been essential from the dawning of this so-called America. And I tell you, I think that we're mature enough to have a real deep and hard conversation to begin to unpack systemic racism, systemic poverty, ecological devastation, the social and economic costs of endless wars in our community, and the distorted moral narrative that my beloved Bishop, Reverend William Barber III from the Poor People Campaign, a national call for moral revival, and I would be remiss not to mention.
Absolutely.
Ms. Theo Harris, who I've worked tirelessly over the years, mobilizing and organizing from the bottom up. Now, justice starts from the bottom up. We must lift the bottom. If we don't lift the bottom, nobody rises. No one will rise. And we have to come together in love and justice, as Dr. King said, in order to change this society. We've got to do it from the bottom up.
Great.
I implore people to go to our webpage and just jump on board. Right?
Please.
We all need each other.
Give us that URL. We all know about Reverend Barber and his Poor People's Campaign, his electric personality and persona that is dedicated and deeply rooted into the Poor People's Campaign. So give us the web address for that organization, please.
Currently, it's of course www.june2020.org. And you can register and sign up. We're going digital for our Moral March this June 2020. We invite you all to come and throw your demands in the hat alongside of us, because we have to do it together. It's 140 million poor people across this country.
Thank you very much. He was on Christine Anapour's program on PBS, and I heard about this phenomenal event that's taking place digitally. So thank you very, very much for that, Savina. Great. In timing with that, I want to bring on Tony Vandermeer. And my question to you, Tony, is what strategies, mechanisms, resources do we have to decrease COVID-19, the outbreak in the Black community effectively? And again, we're taking in all of the other things that we've talked about since 7 o'clock this evening into consideration. Tony Vandermeer from UMass Boston, share your thoughts.
Well, thank you, Carolyn. Well, first, I want to start off by pointing out that it was Joanne Gibson Robinson who organized those women in Montgomery around the bus boycott, and that people should go and get her book, right? Which is the Montgomery bus boycott and the women who started it. And that, you know, she had organized the Black Women's League and so forth. So she was one of the principal organizers around that.
Mm-hmm.
But in terms of strategy, and we point to that, is that, yes, Tito raised it, yes, look what these folks did, and particularly women, and who in fact were academics as well, and had organized with the grassroots, right, to put off this unbelievable boycott that we haven't seen anything like since. So the real deal is that we don't have a strategy, right? Why? Because we're fragmented. And that based on what Dr. Kamara said, is that we still live in, you know, the post-traumatic slavery syndrome. We are still suffering from oppression, psychoneurosis, okay? And that when a young teenager right around the corner from my house on Topliff Street could be shot dead by apparently by another 18-year-old teenager, and and people just looked at it as being random violence, they're making a fundamental mistake. That is a health crisis, right? That has historical origins that we have yet to deal with. So, what strategy we need? A unity strategy. And the truth of the matter is that it's going to get worse before it gets better, right? Why? Okay, because as long as many of us who have the privilege to be on this program right now lose some of that privilege and cannot get internet access, cannot get stuff that we need in the shopping market, in terms of toilet paper and all that kind of stuff, then you're going to see some real rumbling going on, right? But the reality is that we are the gatekeepers, and that we get compromised by the city, by the state, and many other people, as opposed to challenging them on the things that we should be challenging them on because of our own comfort and our own privilege. So we need a strategy, right, to bring unity to stop that nonsense from happening, because it's going to happen again. How in the world is the mayor going to set up a commission or task force and pick everybody except folks in the Black community and even Black academics? By the way, the question came up about a Black political task force. I was president of the Black political task force for 2 terms, right? And that is not about a Latino task force, which they can have as well, but it's also, as Yvette said, what about those Black people who are Latinos who don't identify with being Black? Right. That's part of that slavery syndrome. You understand? And 2, and Atiya was very good because she talked about gatekeepers. She talked about, competing with one another, and not waiting on government, right? If we wait on government, then we're going to be in bad trouble. That doesn't mean that government should be doing what it should be doing for us, but it hasn't done that for us for a long time, okay? Even after the Civil Rights Movement, we have to ask ourselves, what were our gains? What do we benefit from besides electing Obama? And what benefits did we get from that, right? Because we're not organizing ourselves the way we should. We're not organized, as Savina said, from the bottom up, where the people who are most impacted will be able to articulate what their real needs are. It is absolutely shameful that all the talk that the man of governor has done, they couldn't get resources to make sure that people in the most vulnerable community had masks and had sanitizers. That is shameful.
Yes. Yeah.
But what are we doing about it?
Well,
the point is this.
Mhm.
That we have to stop using political opportunism and personal opportunism and organizing ourselves in a collective and a cooperative way so that we could be able to press government to give us what we deserve and what we should have. And otherwise, we're going to be in even deeper trouble. Now, how we do that, as Jemadari said, this is very complex.
Well, the complexity is going to continue April 30th when we continue this conversation. Tony Vandermeer, you brought up an awful lot, going from fragmentation to unity and developing a strategy to really make a difference. I want to pause for 10 seconds because Gwen Simon Porter has put in the Facebook box that her father passed away in a nursing home on April 13th, 2020 from COVID-19. And our collective sorrows and sympathies and prayers go out to the Porter family with this deep, deep loss. I want to bring on Kevin Peterson, who was really the visionary for this particular event. Kevin, please take yourself off mute, put your camera on, and tell us where do we go from here in our remaining minutes. And we obviously have lots of questions that will continue on with our April 30th event. Kevin Peterson, take it away.
Well, we're not sure where we go from here. We're mapping that out. I'm so humbled to have heard from all the panelists in terms of their information and their vision. We do know the condition of the community, the Black community, the Black Latino community is dire in Boston. It's a difficult situation. We need to call upon ourselves, our collective ingenuity and innovation within the Black and Latino communities to do self-help. But we also need to call upon government, city government, state government to respond to the disproportionality of suffering and death in our community. So I don't have answers, but I'm so glad that the people who are on the line tonight and who are speaking truth to power have offered. So I don't want to take too much time. I'm kind of not quite a referee, but I'm kind of here to hear what folks have been saying. So Jemadari has touched on so many important points, particularly around the legacy of slavery that is captured in this experience in 2020 around COVID. I would like him to say some more about that because it's very important. There is a long narrative, I believe, that takes us from how Black people were treated at the founding of the city and the nation and where we are now. None of this is disconnected.
Right.
It's a long story. And I think, Jemadari, could you elaborate a little more around the legacy?
Right. And what we'll do after Jemadari speaks, I'd like for everybody to take your, we'd like to see you. So we'll have all of our speakers to come forward. We'll ask you to take your camera lenses off. So make your camera visible, take your mutes off, unmute yourself. This is after Jemadari speaks. So that we can have one last round. Again, we have lots of questions that are going to go automatically to our April 30th event, and we will be in conversation with you throughout the next 2 weeks. Jemadari Kamara.
In a very unusual way, this idea of PTSD that we understand in our own immediate lives represents both the consequence in what we experience, but also the cause in terms of our structural relationship to the absence of power. And This has been historical. This has gone on since the period of slavery. It's not something new. And when you look at our continued powerlessness over that historic time, and our relationship in terms of the economics and the politics, coupled with now the medical issues, it represents the complexity of the engagement that we must have both with the system and with ourselves in our community. Tito, I thought, was brilliant in her comments, and some of our other speakers who were talking about the necessity to confront the paradigm in our own minds, how we think, not only about the system, but ourselves, how we relate to one another, how we begin to build, as Tony was talking about, this necessity for unification, but it has to be structural, right? Because that which we are dealing with is a question of structural relationships. Mm-hmm. This issue of racism embedded in our society. People that sit talking about they need more data, and well, in a scientific sense, with regard to the medical issues of COVID-19, yes, we need data, we need more data. But in a political and economic sense, we had years of data. We've got decades of data that were predictors of the consequence that we're now experiencing. And if, following the logic you hear on TV, if we are to follow the science told you that this would be the outcome. How do we now structure ourselves, however, the collective of our community, to engage one another in the absence of government support or with it? Mm-hmm. Because it is it's not an either or proposition that we have to engage. Mm-hmm. It's not that we're not going to deal with the government or the city or the city's commission. Yes, we're going to deal with that, but we're not going to rely on it because we have historical experience that tells us where that's probably going to go. But we need to be at that table. But simultaneously, we need to be engaging with one another. We need to be dealing with innovative, productive capacity. Let me give you an example. Let me be concrete. One of the dynamics going on in Detroit, and I want to speak to this, Carol, you're my sister of many, many years from Detroit. One of the things that has happened in that community, Detroit is a city of 139 square miles. Detroit has two fully incorporated metropolitan areas inside of Detroit. It's an enormous city. The city of Boston and Washington, D.C. could fit inside of Detroit, and you'd still have some of Detroit left over. And what has happened is that they have now, because of the whole gentrification process, begun one of the largest urban farming programs in the country.
Oh, that's right.
And they have taken that land and developed cooperatives, right, producer co-ops, that are now selling to a local cooperatives in the city. Now, if you've watched television over the last week, you've seen farmers dumping food in this country. Milk producers pouring the milk down the drain.
Right. Right.
Here you have an urban experience where people have become producers on the land in our own communities, mm-hmm, and are producing food, and they are now about to buy the building through which they're doing retail sales of the cooperative. Wow. Using a cooperative model, mm-hmm, coming together, becoming producers. This is a small scale, but it is very important, and it speaks to our human needs, the human need of life, of quality food, of productive work. They're using solar technology on the land. We need to couple innovative ideas the appropriate technologies that are available to us. We had Tito on earlier, and some people have issues with marijuana production and so forth, but the Mayo plant of hemp historically was one of the most significant producers of cloth, of material, of rope in our country. And for a whole series of reasons, it was eliminated. But we have the capacity to begin to think outside of the box, to become producers for ourselves, to engage new ideas when we think and work with each other. I don't claim to have all the ideas, but I do know that we have to look to one another, that when we're talking about the issue of COVID-19 and health, and I know I'm in that high-risk group, but the question of community health is the most important variable and the thing that will allow us to survive.
And that is a perfect way to segue out the community, the collectivism. I'm thinking about the executive director of the Urban Farm Institute, Pat Spence, who I just honored at my Black History Breakfast, and what they're doing with that land. Jemadari and I grew up around the corner from each other. So you're talking about a lot of those abandoned homes that have been torn down, and they now have farming units there. Brilliant idea. So again, I'm excited about what's going to happen on April 30th, just continuing on with these words of wisdom. Very quickly, 10 words or less with our keynote speakers. Take yourselves off mute. We'd love to hear 10 words or less. Where do we go from here? Part 2. Savina Martin?
Well, I think that we need to continue. I love this group. We've got a lot to unpack. Let's go.
Awesome. Tony Vandermeer?
Well, we have to build unity, and we have to make sure that we start to deal with the real needs of people who are the most impacted.
Great, thank you. Yvette Modestin?
Same, just we need to see each other, and we need to remove the chains from our own minds to be able to see each other. We need to see all facets of our community as one of us, and not allow the classism, the capitalism that exists in this country impact how we deal with each other as a Black community. And also to think that this is a global issue. Yeah. I can't help but think that, you know, when we think about the Black community here, we have folks all over the country that are part of our family, part of the international piece. So I ask us to also look at what the bigger conversation around the government and the sanctions that it has on other communities and other countries, and those most impacted in those countries are also people that look like everyone that's on this conversation.
Absolutely. Awesome. Thank you. Jemadari Kamara.
There's a South African expression called Ubuntu. It means I am because we are.
We are.
And in order to move forward, we can only do that together.
Awesome. Thank you. Atiya Martin?
This is hard. I'd say number one, don't think of yourself as powerless. The system wants you to believe that you have no power, because that is how we all get hustled by the system of racism. However, we have consistently throughout our existence shown our resilience. And I don't mean resilience in the sense that we just deal with the stuff that gets thrown at us. I mean resilience in the sense of being change agents to recreate and restructure what's happening around us. And it's happening in micro pockets around the country. And we need to learn more about all of those movements that are happening and how people are actually leveraging their own knowledge, skills, tools, resources in order to address the issues they can with what they have. And so I am super excited to continue with this group. I appreciate all of you. I appreciate all of you who have stayed tuned in with us, and intentionallyact.com.
Awesome. Dr. Jacques Carter.
I'd just like to put a layer on what Jemadari had to say, that is a good friend, and I think you may know these folks, Michael Bird and Linda Clayton, two physicians who published two books, The American Health Dilemma, both of which got nominated for Pulitzer Prizes. And but he spoke of a concept he called the slave deficit, and that we're having so much trouble because we got so far behind from slavery that we're having one hell of a time catching up. And I just wanted to lay that on what you might have to say, because it was so precious.
Awesome. Thank you. Tito Jackson.
The cavalry is not coming. No one is coming to save us but us. You know, in the old cowboy movies, it's usually some cavalry, some white guys on horses that are coming over to save folk. That the cavalry is us. We are the leaders. We are the doers, and we are the transformers that we need. And also, I would inject that if we all do a little bit, then that means no individual has to do a lot. Collectively, we have exponential power to be actually the change agents that we need to change our time, our space, and our place.
Awesome. Awesome. Savina, I did call on you for your 10 words, didn't I? Thank you. Reverend Gloria White Hammond.
Hebrews 10:35, don't throw away your confidence. You need to persevere, because we don't come from people who shrink back and are destroyed, but for people who persevere and are saved.
Amen. Before I turn it over to Kevin Peterson, I want to remind everyone that the New Democracy Coalition, they are recording this event, and you can view it immediately afterward on their Facebook page and at their website, thenewdemocracycoalition.org. That's thenewdemocracycoalition.org. Thank you so much. It has been an esteemed honor to be your MC and moderator for this evening's program. We have so much more to do and to say. And without further ado, I'll turn it over to the Executive Director of the New Democracy Coalition of Massachusetts, Kevin Peterson.
Great job, Carol. Great
job.
Thank you.
Thank you.
I was about to say the same thing. We can collectively.
Thank you.
You're the bomb.
Just extraordinary. Thank you, each of you panelists, for being here tonight. Thank you for your brilliance, your insight, your innovative thinking. We are going to come back on April 30th to talk a little more about where do we go from here. We have a number of other guests who are just pining to be on the event tonight. They are equally important. I want each of you to come back. I think we need to really think about how we engage ourselves internally within our community about how we move forward. But we also need to think about policy. Slavery in this city was a policy. There's a legacy of that connects us to where we are now. We need to think about public policy. Thank you again, everyone, for being part of this, and all the listeners. There have been hundreds, and there are hundreds of comments I'm looking at now. We're going to come back. Please reach out to me individually if you have any questions or you have any ideas around how we make the next conversation better and more inclusive. We didn't have any millennials on. So we want to come to that the next time. So thank you again for being part of it. My email address is thenewdemocracycoalition@gmail.com. Let's stay in touch. Let's stay safe. Be well. Carol, you're wonderful.
Thank you, guys. I appreciate all of you. Jeff Durham, you're the bomb. He's behind the scenes running everything. And thank you all so much. Take care, everybody. Bye-bye.